We call this segment Coronavirus Q&A, where we separate the facts from the fear and some of the fiction that's out there. We know as a fact that tonight 1,126 positive cases have been detected of COVID-19 in Bexar County. The San Antonio Mayor Ron Nirenberg joins us now live.
Hi, Mayor. I want to start by asking about reopening plans. A lot of governors across the country, including our own, are talking about reopening businesses. We anticipate this is something that's going to come down the pike relatively soon. Should this happen before you're ready, before San Antonio is ready, before your economic transition team says we're ready, then what?
Yeah. Based on the health guidance, we know that opening up carelessly would cause even more pain than we've already seen. And so our hope is that the state, just like San Antonio and other cities, are going to take a thoughtful approach and make sure we're going by the medical guidance. Not doing so would risk lives, but also risk livelihoods, because the whole effort here in making sure that we're controlling this infection curve is to make sure that we don't have to go back into restrictions after we come back out. We don't want to have two big peaks that cause more pain than is necessary.
Do you expect that the governor will ask you for your input on this whole thing? I mean, I know that he has been in San Antonio and had one of his news conferences down here.
Yeah, well, we've been in contact with his office and with him. I've talked with the governor many times over the last month. I have been in contact with members of his transition team as well, and told them, look, we all want to open back up. We want to open back up as soon as possible, but as soon as safely possible. And so we are making sure that they're aware of the process that we're underway right now, that we put together the best team of medical experts that this community can muster, and we're going to get all the data and ensure that, as we can ease off of social distancing restrictions, that we are doing so to save lives and to keep this a healthy community and a healthy economy. A healthy economy starts with healthy people.
Now, Mr. Mayor, it feels when we're listening to your daily briefing every day at 6:13, it feels like we're in good shape. I mean, the confirmed cases are going up, but that's to be expected with the increase in testing. The deaths have not increased over the past several days. Is that your assessment as well? I know just from us covering it in the news, it feels like San Antonio is in a relatively good position.
We had an early start with coronavirus with our participation in the evacuation missions that took place on Joint Base San Antonio. So we've had a heightened awareness of this for quite some time and have had two hands on the wheel since this all began. So that feeling of confidence that we have this under control is well-founded, because I think our medical experts, our frontline workers, our hospital techs, the paramedics and EMS firefighters, all the folks that are leaning into this effort are in control and will keep this under control. We just have to continue to go by their expert guidance as to how we change our operations, whether it's social distancing or easing off of social distancing. But the numbers are good in terms of our ability to treat the ill. Hospital capacity is the function of this, flattening the curve. We want to make sure that we have the capacity to treat the people who are infected and save as many lives as possible. And that's exactly what's happening here in San Antonio. We just have to keep the effort and stay on course.
You were very clear in your briefing today that this mask is a mask order, not a mask recommendation. Why did you make that clarification?
Well, again, you may feel fine. In fact, for most people who carry the virus, they may feel fine or have minor symptoms. But the mask is to protect other people from you. That there is good evidence to show that, if you're wearing a mask and expect to be completely protected, you're not. But this will slow down the spread of the virus. If you sneeze into a mask, if you have a cough that you can't control, this mask will allow that spread to be very minimal. And so you are protecting other people from you. And we don't want people to be flippant about other people's health. This is not something we look forward to doing. We're not, we don't look forward to having to control a pandemic in our community. but it does require us all to be on board. And we all are in this together. We keep saying that. And part of that is that you do your part to protect the health of the person next to you. And that other person might, in fact, be the person who doesn't spread the disease to someone you love who could lose their life because of it.
All right, much more with Mayor Ron Nirenberg coming up after this short commercial break.
We're back with San Antonio Mayor Ron Nirenberg. Mr. Mayor, your order currently, your emergency order goes through the end of this month. Are you already looking at extending that, or will you take your lead from what the governor's office decides to do?
Well, it's unclear what the governor will do, and we've been trying to get a little bit more clarity on that. But regardless of that, there are still going to be gaps within the governor's directive statewide that we'll need to fill here, particularly as it relates to relief of things like evictions and the utilities and making sure that there's proper reporting to Metropolitan Health District, ensuring that we have continued safety measures like the movement of staffs between one long-term care facility and another. So there's still reasons that we'll need to extend it. Just what those reasons are, though, is unclear until we hear a little bit more from the governor.
All right, Mr. Mayor, that's all our time for today, but I understand you're coming back at 9 o'clock. We do have some more questions for you, and so we'll get to them then.
Get to the viewer questions
Yes.
at 9 o'clock. I appreciate it.
Thank you,
Mr. Mayor.
us. We'll be right back.
Fighting fear with facts. It's what we're attempting to do every night during this pandemic. At around this time tonight, we're joined by Mayor Ron Nirenberg, who, of course, gave one of his city briefings today, talked about the importance of masks, gave the latest numbers. And we're finding out just moments ago, actually, Mayor, we were talking about the fact that you're going to have a special meeting next Tuesday. Is that right? With
Yes.
both the county commissioners and the city council.
Yeah, so Tuesdays at 1 o'clock, the city council has been meeting to go over the working groups and the teams of city council members, community members, and court commissioners working on these urgent issues that the crisis has dropped on us. But on Tuesday next week, we will have a special meeting of the city council and the commissioners court together. We will primarily be hearing the public discussion of the health transition team's recommendations. So it's a big day with regard to where we are and the products of the work that we've been doing together as a community on social distancing and flattening the curve.
I don't know that there's ever been a joint meeting between the commissioners court and the city council before, so that could be historic.
I'm going to talk to the judge about that. We were just talking about should we do this today, and both agreed immediately it would be a great show of solidarity for the community. I got to ask him. He's probably the one that would remember such a thing, but I can't remember it ever being done. And this whole effort to control this disease is about teamwork. This entire community coming together. So I think it's a great show for the council and the commissioners court to come together for a briefing.
All right, let's get to some of our viewer questions tonight. The first one, do you anticipate there being discrepancies with the city county's timeline to reopen the economy and the state's?
It all depends. If the state mandates a timeline, then I do see conflict because, we in the urban population centers of the city, of the cities, the major metropolitan areas of the state have been working together and have been on a different timeline. We had to issue social distancing measures before the state acted because we saw the threat looming with regard to the spread of this disease. And so, I think our health transition team recommendations will give us a little bit more clarity on what timeline there is. But if there is a rush to open things up before the health recommendations say it's safe, then there will be a conflict. I'm hoping that the governor will continue to provide some latitude based on the health data that's happening locally, whether you're in Bexar County or Travis County or Milam County. And I think that's going to be the marker of success as to whether or not the state can get through this as quickly as possible, because we don't want to be back here again. We want to do this once, have to shut down things, slow the spread of this disease, one time. If we're forced back into more closures all over again, it will be all for naught.
Next question. Is it safe to drive in an open car, such as a convertible or Jeep, during the pandemic? Do I need a face covering while driving in an open vehicle?
Yeah, if you're driving alone, you don't need a face covering. And, if you're driving with other people in your car that are members of your household, you don't need a face covering. But if you're driving with people who aren't in your household, you should wear a face covering. And it's, a cloth face covering is best because we need that surgical grade PPE available for our healthcare workers. But the cloth face covering is primarily to protect other people from you, because the carriers of this disease quite often don't even have major symptoms. And that's how it's spreading to people who get very ill, and ultimately many who die from it. And so the cloth face covering protects from, things that are expressed when you cough or sneeze, or even sometimes when you're speaking. And so, if you're carrying the virus and you have a cloth face covering, it helps slow down that spread. Obviously, if you're driving in a car, though, that's not likely to happen.
Yeah. Next question, I think you kind of just answered it, but we can maybe take it in a different direction. But why is it mandatory to wear a face covering in public when it does not protect my health, even when I know I don't have COVID-19? And I think you kind of just answered that. It's for everybody's health. But I know
there's a lot of research. Yeah, there's a lot of research left to be done. But what is becoming clearer is that asymptomatic carriers are driving the spread of this disease. And so it's to protect other people from you. There is a little bit of protection, though, that comes with wearing even a cloth face covering. So don't dismiss that either.
Well, and you talked in the briefing today about the fact that you're hearing businesses that are open where customers aren't wearing face masks, correct?
Yeah, and grocery store workers are part of the first response for this. They're essential workers because they're putting food on people's tables, and let's not make their lives more difficult by walking into a grocery store and without your face mask on. Again, you're potentially exposing others to risk who are customers, but also those grocery store workers who are, not. They have to be there, and so let's not make their lives more difficult. Just wear the mask, and stores won't have to, go through the extra effort of enforcing the face mask ordinance if you just keep it on.
Right. If you don't have any symptoms, can you still get tested? If tests show positive, but you don't have symptoms, do you have to get retested?
Yeah, so far, the guidance has been the presence of one or more of the COVID-19 signature symptoms. And the primary one is the presence of a fever, a high fever. The other is a cough, a dry cough. There are other symptoms. And if you call the hotline, you'll get screened. The question has always been about asymptomatic tests. When would you get one? If you've been exposed, if you're part of a vulnerable population that may have been exposed. For instance, we've had some asymptomatic tests done for people in nursing homes. But we don't, in the United States, have the number of tests, the volume of tests, and test equipment available to us anywhere in the United States to begin massive testing. It's one of the weaknesses of the United States preparedness for this pandemic. And so we all want to do asymptomatic tests. We want to do community-wide screenings so that we can know exactly where this disease is and the infections are, but we just don't have that capability here in the country. We're fighting every single day and expanding testing capacity every single day, and doing so in a methodical way. But right now, nobody has in this country the ability to do wide-ranging asymptomatic tests.
Okay, my next question has to do with Fiesta. Why has November Fiesta not been canceled, given what the CDC is saying about the second wave of the virus?
Well, the CDC is saying that a second wave of the virus is likely if we don't contain the spread of this disease. If we let off the gas in terms of the containment strategies and the social distancing practices that we are exhibiting. So, there is a likelihood there will be a second wave, and people are pointing to the fall of the likely presence of a second wave. We don't know what therapeutics will be available. We don't know if there's, some vaccine that's developed. It's unlikely, but maybe there is. So, with all optimism and hope, we're going to party in Fiesta in November. But I will tell you, if the health guidance suggests that we are going to be in the middle of fighting this pandemic, a second wave of this in fall, we will cancel Fiesta. We don't want to have to do that, but I think it's a little bit too early to make that decision.
All right, I want to give you the final word tonight. What do you want our viewers to know?
So stay the course. What you have been doing is painful. We know people are frustrated. They're home and they're cooped up in their houses, and they really want to get out and enjoy the activities and go visit friends and, have a great meal at the restaurant that they used to go to. I'm right there with you. And, we will be able to enjoy those things again. We'll be able to cook out in our neighbor's backyard again very soon. But the ability to do that and enjoy life again depends on us staying the course. We have worked very hard to see this curve flatten. We have saved countless lives, thousands of lives already. And we are inching closer to the apex of this disease. Stay the course. We will get through this. And if we do our jobs correctly as a community, we will only have to do this once. This has been a painful process, but we are all in this together. We will get through this together, and we are going to be back stronger than ever.
Next week at this time, hopefully we'll be talking about what we see in our next Bear Facts poll. And we asked a lot of COVID-19 questions in there, kind of what the community is thinking and what they think, how patient they are with the stay home, work safe. So we'll talk about that next week.
Thanks a lot, Steve. Have a great week.
Thank you, Mayor. We'll be right back.